afternoon, everyone. I'm Roger Galloway. I'm the Mohave County Communications Director. Welcome to our press conference with the 4 area hospital CEOs in Mohave County and our County Health Director, Denise Burley, as well. I'd like to thank all of the CEOs en masse for participating in this rare event concerning the current COVID-19 situation in Mohave County. In the past, they've all been transparent and informative on this very urgent issue. Participating today, from left to right on the screen, are the Mohave County Health Director, Denise Burley, Mike Stinger from the Western Arizona Regional Medical Center. We then have Will McConnell, Kingman Regional Medical Center, and then Mike Patterson, Havasu Regional Medical Center, and Feliciano Huron from Valley View Medical Center. I want to thank you all for being here. We have media on the line right now. Again, this is a press conference for the media, and we are going to allow each of the outlets, when I call upon them, to have one question and one follow-up question as well. After that, any one of the media that I've missed can chime in by announcing themselves and who they represent. I may have some questions which have been texted to me by the media as well. For instance, the Kingman Miner has sent me a text question already. And then we're going to open it up for additional questions from the press. First, we'll begin with an opening statement, if you desire to make an opening statement before we turn to the press, from each of our 5 participants. We'll start off with Mohave County Health Director Denise Burley. Denise.
Good afternoon, and I want to say it's been some time since we've had all of our hospital CEOs with us, and I hope you'll take advantage of the time to ask them questions about their facilities and data and research that's available out there, and we use this time for their expertise. Thank you.
Mr. Singer.
Thank you, Roger. About 10 weeks ago, our hospital had 3 COVID-positive patients that were sick enough to be hospitalized at the facility in our isolation unit. Today, we have 22. And I have to say that the 22 that are hospitalized with COVID, 98% of them are unvaccinated. And had they had a choice to rethink their decision not to get vaccinated when it became available, I think they would have chosen to do something different.
Thank you, sir. Will?
Thank you. So since this began over a year ago, at Kingman Regional Medical Center, there have been 3,799 positive cases. And since this recent Delta variant surge, as of July 1st, there have been 512 cases. Currently, Health and Human Services, through a request to the county and then up through the state, is here in Kingman, as well as Bullhead City, helping with monoclonal antibody therapy distribution. So quickly, monoclonal antibodies, what they are proteins that mimic the body's natural antibody to fight COVID-19 and work by binding to the spike protein, blocking COVID-19 from entering human cells. So with that treatment, a patient receives a one-time intravenous infusion of those monoclonal antibodies. And that has been incredibly successful in the patients that have received that therapy, and it's most effective 10 days after symptom onset. Previously, monoclonal antibodies have been used for treating cancer, autoimmune disease, and other health conditions. So this is not a new technology. It is simply using existing technology to combat COVID. 12 and over are eligible, and those that test positive within 10 days of symptom onset, or someone who's unvaccinated and has had close contact with a COVID positive person. So there's also a lot of conversation right now about booster shots. What we know currently is the CDC guidance that the need for and timing for COVID-19 booster doses has not been established. No booster doses are recommended at this time, but the guidance may be updated. And I know that there is a meeting happening on Friday to discuss the current state. There have also been a lot of statistics being thrown around, similar to Mike. 98% of patients hospitalized for COVID complications were unvaccinated. And then from July 1st to August 8th, 2 of 121 patients were fully vaccinated and hospitalized. So we have experienced some breakthrough admissions with people getting COVID that have had the vaccine. And we know with any vaccine that 100% effectiveness at preventing illness is not quite there. So a small percentage of fully vaccinated may still get COVID. But studies have shown that those who have received the vaccine and become infected usually experience milder, shorter illness and a lower viral load. A couple of other quick things. To date, 82.2% of COVID cases are the Delta variant. So that uptick in cases is real, and that surge is real. Then the last comment here is, due to maxing and vaccination becoming so politicized, we've lost the opportunity to receive objective information. And what happens is, when we don't receive objective information, it makes it really hard to decide on appropriate course of action. And so the request there is for folks to kind of recognize their own confirmation bias when it comes to consuming media, and to be open to productive dialogue about the different positions people are taking relative to vaccination and masking.
Yeah, thank you for the opportunity to be here and to discuss this important topic. We continue at Havasu Regional Medical Center to follow the current CDC guidelines regarding safety and infection control protocols for healthcare personnel, just as we have throughout this pandemic. And this includes masking, hand hygiene, and isolation protocols. We would like to reassure the community that it is safe to come to the hospital should you or your family need care. We are taking all of the steps necessary to protect our patients and our staff. With the current Delta variant surge, we would like to stress that the best defense is to get a COVID-19 vaccine. And we encourage everyone that you know to also get the vaccine. We, as Will has shared, have seen the same numbers. Those people who are being admitted to the hospital are 90 to 98% the ones that have not been vaccinated up to this point. And so we feel that that is important for us to get that message out there. It's also wise to wear a mask when you're around people that you can't socially distance from, and practice proper hand hygiene. So I appreciate, again, the opportunity to be here, and look forward to the questions from the media.
Thank you once again for allowing us to be here, and for having us here as part of this media item. Valley View Medical Center's top priority, as we continue to protect the health of our patients, our providers, and those individuals coming into the facility, is to ensure that we adhere to the CDC guidelines that continue to come out to us on a regular basis. We understand that there are individual views that people have out in the community. Our intent is to ensure that as patients come through our door, as individuals come through the door for care, that we are providing the best possible and safest care. We encourage individuals who are ill to please come to the facilities, come to the hospitals. We are safe and clean environments for individuals to come and get their care. Again, we are being challenged by the influx of the new variant that is coming through the door. We've seen a substantial amount of patients that are coming through our organization as well. 93% of our patients that we have admitted for COVID have been unvaccinated. Again, a big push for us, again, seeing that those individuals coming through the door are not vaccinated. We are, again, asking the community out there to reconsider getting vaccinated. The other piece that we are also seeing is that 50% of our COVID patients that we are admitting are under the age of 60. And so we are seeing a younger group of individuals coming through on this new wave of patients. Again, we are referring to this as the unvaccinated and the younger wave, as we're calling it inside many organizations. And so again, we ask that the public please take care of themselves, wash your hands, practice safe and social distancing, And then again, work with others around you that may need help and your neighbors and friends that may not understand, and have some of these conversations with them.
Thank you. We'll start off with the Kingman Minor. I have a question that was texted to me, and if Travis is on the line, and Travis Raines, the reporter, wants to chime in with another question following this, feel free. I think this will go to KRMC especially, but any of the others up there can respond as well. His question: increases in the number of infections and hospitalizations of children suffering from COVID-19 have been noted nationwide. Has there been an increase of hospitalizations and infections in ages 12 and under that aren't eligible for the vaccine in Mohave County, and specifically at KRMC? The people in the audience have to be quiet, or they're going to leave. That includes you, sir. I'm sorry, we're being interrupted right now by someone in the audience. So would you like to answer that, sir? All right, sir.
Sorry, I'll turn on the mic and say that again.
Yeah, would you
I was
mind?
going to do that at least once. We have not experienced 12 and under as a significant population of COVID-infected individuals at KRMC.
All right. Any of the others want to comment on that question?
That's the same situation at Havasu Regional as well.
That would be the same also at Valley View.
All right, sir.
Same thing at Warmsey.
All right. Travis, are you on the line? If so, would you like to ask a follow-up question?
Yes, sir. Just one quick follow-up question to that. So taking your all's responses into account, have any of the hospitals or the county health department taken any position on mandating masking or vaccination in county schools? Thank you.
I can take that one. So, no, we don't mandate schools' behavior and actions and policy. The school administrators and school boards are the primary entities that have the authorization and responsibility for making policy within a school.
All right. Do we have a question from the Lake Havasu Herald? Is the Herald on board with us?
Yes,
I'm sorry.
assuming you're referring to today's News Herald. Joey here. Yes, I wanted to ask Mike at HRMC what the current occupancy is at the hospital and in the ICU.
So the census, changes really hourly, but right now in the hospital, as far as COVID patients, we have 14 COVID patients in the hospital, 4 of whom are in the ICU.
And just a follow-up, has the influx of COVID patients affected wait times at the hospital for unrelated COVID issues for people?
Well, as we have COVID patients taking up beds in the hospital, then yes, that can delay other patients getting in. I think the biggest issue for most hospitals right now, and this is nationwide, is having enough staff to be able to handle the current patient load, let alone if we have a continued increase in COVID patients. And that's honestly my biggest concern. It might be the same for everyone here, is that if we continue to see these COVID numbers increase and more hospitalizations, will we be able to have the capacity to take care of those patients?
All right, thank you. You have another question there, Joe?
No.
All right, the Mohave Daily News.
Yes, Bill McMillan. Thank you for the opportunity. The investigation process of the positive cases, there seems to be some confusion on what's actually entailed. Can Denise describe what the process is and how contact tracing is being carried out, especially with a spike in cases?
Certainly. So we have staff here, our nurses, who follow up with all long-term care facility and school cases. And then we have a set of investigators that follow up with all positive cases for those that exceed our capacity to follow up, we transfer those cases to the Arizona Department of Health Services, where they have hired approximately 600 case investigators to then follow up on those cases. So they become our overflow. And then they also do the contact tracing. So the case investigators investigate both the case and they investigate the contacts and follow up with all of the contacts.
All right. You have a follow-up on that, Bill?
Is that, how challenging is that when you have a populace that is quite mobile here?
Right. You're asking more or less how successful are we in our efforts to do the case investigations and contact tracing? Right, exactly. Yeah. So, I think our case investigators have been doing this for some time. They've been trained and they've gone through this process for about a year. I can't speak to the ADHS training. I am assuming they've gone through the same process and have, either have previous experience or have received enough training to do this case investigation work. I think we have to rely on the public to provide us with information. If we follow up with a case and they do not return a phone call or they don't answer their phone, there's only so much that we can do on our end to have that conversation. And the same with contact tracing. If we get names and phone numbers of those that have been contacts, we certainly follow up with those individuals. But if those people do not call us back or don't respond, we don't take any other steps other than to send them a some certified mail with information and guidance about isolation and quarantine and steps that they should be taking to prevent the spread.
All right. Paul Lavoie from Radio Central.
Yes, Roger. Thanks for the opportunity. This question's for Denise. With the uptick in cases and the Delta variant in that, are you also seeing an uptick in vaccinations, testing, or both?
We have seen a slight uptick in vaccination rates in the county, or more or less what we've seen is an increase in orders for vaccine among our providers in the county. As far as testing, I think we are starting to see an uptick in testing, and we'll be working with some of those providers to, if needed, increase their hours of operation to ensure that we can get testing done in a timely manner. But testing is also available at your local pharmacies. They have Buy Next Now tests and some of these rapid tests which can identify a case very quickly, and then those individuals can take the proper steps.
All right, Paul, you have a follow-up?
Yes, also for Denise. I've heard that the Delta variant is also, was formerly known as the India variant, and has already run its course pretty much in Great Britain and Israel, from the reports I'm getting anyway. Do you see that happening here in the United States? It's kind of a two-part question. And what's the level, the vaccination rate here in the county as far as herd immunity goes, and when we will achieve that?
So, I think it is cyclic. I think what we see in other countries, we can expect to see here around some of these variants. In terms of our herd immunity, we have about 40% of our population has received at least one dose of vaccine. So we are quite a ways from any herd immunity place. And I know there's a number of individuals that believe that they've had the virus and they've recovered and they have a natural immunity to the virus. And the question is, how long does that last? And at this point, that's a very individual answer. That's something the CDC has really set out a guidance of about 90 days, but that is currently under study.
Roger?
Yes.
Just to clarify, this is not an uptick. This is a third major surge. 10 weeks ago, starting 10 weeks ago, we've seen an increase in testing week over week for 10 consecutive weeks. and we've seen a significant increase in the rate of positivity for those people being tested. Over the last 2 weeks, just at my hospital, we tested almost 400 people that were symptomatic, and 23% of them have been positive. So this is not an uptick. This is a third major surge. And to be honest with you, it's approaching what we had last summer at the same time. It's not going away.
One of the questions that would go to each of the four of you that came up is, what is the most troublesome thing that you have to deal with right now regarding COVID-19 in your hospital? Will?
So the biggest challenge that we're facing right now, to kind of piggyback a bit on Mike's comments, at this time last year, we topped out at about 280 cases. Over the December-January timeframe, we topped out at about 1,008. Right now, we're on pace to hit about 550 by the end of this month. So when you look at the way this is moving through, whether it's the original COVID or whether it's a variant, it is still having a profound impact. And that translates to the biggest challenge that we face is the workforce and staffing. And the reason why is because our healthcare workers get caught in the political aspect of vaccination and masking. And a lot of the frustration that people experience then becomes directed at our healthcare workers. We are not going to end up as, well, I hope we're not going to end up as high as we ended in that November, December, January timeframe. But we have lost staff between then and now. Healthcare as a whole is losing staff. We have nurses who are close to retirement, deciding that they don't want to deal with a lot of the drama that is around COVID-19. And we have the new RNs and the new workforce saying, you know what, I might just wait a couple of years and then come in, because right now it's just too chaotic. So staffing is our major concern right now.
What about over at Valley View? What's it like there for you as far as the most troublesome?
The two biggest items that we are seeing at Valley View is, again, staff resilience. We have been going through this for quite some time, and as I explained it to a group of individuals, if you're ever around a large tank of fish, they always have these filtration systems in there, and healthcare is that filtration system, but there's just a finite amount of filter or charcoal in that system that is going to filter out all the water and all the things that are happening inside that community of that fish tank. And staff are becoming tired. They are seeing a lot of things that are happening with clinical care. Again, the resilience, their families are being impacted. These are big issues, I think, for us as an organization and for us as an industry. And we are seeing this across the entire spectrum of healthcare in our country right now, that we're seeing quite a few people who are having burnout. Physicians are suffering from burnout. Staff are dealing with this on a continuous basis. And so these are some of the stressors that continue to be impactful for us operationally.
Over at Havasu?
Yeah, it's the exact same issues. It's really related. The biggest concern is related around staffing, and being able to support the staff that we have, and also try and hire more staff to be able to take care of the patient load that is currently needed.
All right, and Mike?
I would say, besides staffing, there are periodic shortages of drug and drug therapies. We've got all the PPE that we need for the most part. We've got the equipment and the other technologies. But like remdesivir, which has been shown to be effective in treating people that are sick enough to be hospitalized with COVID, I know that that supply chain is being disrupted a little bit. We're seeing a more difficult route to go to get replenished.
All right. Do we have, I don't know if they wanted to ask a question or not, but we have someone from ABC on the phone that wants to ask a question. If so, go ahead, please.
Thank you so much. It's actually Nicole Grigg with ABC 15. I've learned that Kingman Regional Medical Center requested assistance from the state for help with that staffing shortage, and now the federal government is now stepping in and sending 28 nurses. They should be arriving soon. That shows that you all are in need. So I'm just curious about your comments on getting assistance.
Yeah, so in speaking to that, so the way that requests go for staffing and for other assistance is it's coordination with the county. The county then helps prepare a response to the state, and then the state will then request assistance from different branches of the federal government. In the December-January timeframe, we received some assistance from National Guard. At this point in time, Health and Human Services is on the ground here and in Bullhead with regard to monoclonal antibody distribution. The process is being finalized at present relative to staff coming from that request that was done a few weeks ago, and we don't have final dates and we don't have final numbers of what support is going to be offered, but it's close to being finalized. And at that point, we will be issuing a press release jointly with Health and Human Services to indicate the number, when it's happening, but we don't have that information quite yet.
Thank you. You have a follow-up, ABC?
Just as a follow-up, as like the CEO of this hospital, you talked about the tired hospital workers, the nurses, working so hard to save lives. They're exhausted, but this also has to be heavy on you.
I'm sorry, I missed the last part of that.
Can you hear me now? I was just curious, with the tired hospital workers and nurses, they're working so hard to save lives. I'm just wondering, as the leader of the hospital, this has to be heavy on you as well as you're watching this play out.
Absolutely. I mean, mainly because the length of time that this has gone on is more than anybody really could have ever imagined. And the impact that has on just week after week of being in the same situation, right, with how controversial different positions are, it is very taxing organizationally. My biggest concern is that we're going to continue to lose an amazing workforce that has weathered the storm to this point and just kind of they're ready for something different. So that does weigh heavily because we take the responsibility of caring for members of our community very seriously, regardless of their position on masking or vaccination status. We're here for whoever needs us, regardless of their position. But that also does create, at this point in time, a lot of long hours and a lot of hoops to jump through to try to get the support that we need.
All right. Anyone else want to add anything to that?
Well, there's no question it's not just nurses and therapists. It's the entire hospital staff, because everybody, whether you're providing clinical care or supporting those who provide the clinical care, everybody's exhausted. And everybody worries every day that they work that they may go home at night and bring COVID with them and infect one of their family members or one of their friends.
Thank you.
And that takes a toll on people after 16 months. To worry about that every single day.
Do we have someone else from the press that I haven't gotten to yet? Would like to say something, ask a question? Chime in right now. All right, do we have anyone we've already spoken to with the press that wants to add a question? If so, go ahead.
I'm Bill McMillan from the Daily News. And this is a question that basically anybody can answer. It's directed toward Denise, but I think the hospitals can definitely chime in. How is the messaging changed on trying to get information out to people and getting accurate information and timely information out?
So we continue to issue press releases, and when new information is available and changes in guidance, we try to include that into our press releases. We can do what we can do, and we certainly try to provide resources and the sources of our information, which is generally going to be CDC. for that information. I recognize there is a lot of information out there, and people have to sift through that to find what's, the actual research. And, we're hopeful that people will take those steps to do that.
We have another question from the press?
Yeah, Roger. Paul Lavoie, Radio Central News.
Go ahead.
This is for Denise. Is there a way to report the numbers of positive cases where we know how many are vaccinated and how many are not vaccinated?
Yes. We are looking into that right now, and I don't have an answer for you, but we'll continue to see if that's a possibility, okay? We understand that there's an interest there.
Thank you.
Mm-hmm.
Here's one for each of the 4 CEOs. What percentage of hospital beds are currently in use at your hospital for COVID patients? If you know the approximate or the exact number.
We're talking about available beds or beds that are filled with COVID patients?
What percentage of beds are currently in use at the hospital by a COVID patient?
As of this morning, we had 22 beds filled with COVID-positive patients in our isolation units.
All right, sir.
Yeah, so for Havasu, it's running probably around 15% of our total beds are being occupied by COVID patients right now, of the total population that's in the hospital today.
All right.
For Valley View, we run anywhere between 15 to 20% occupancy for COVID patients. It just depends on how that volume fluctuates as patients come in and get discharged.
All right. And over at Kingman Regional?
Yeah, the challenge with answering that question is the complex COVID patients that end up in the ICU. It's the ICU bed capacity that becomes the biggest limiting factor. Non-ICU related COVID patients, there's plenty of capacity on the floors for those that don't need to be intubated or don't need that higher level of care. But just for context, so we have 154 in-house, 25 of which are COVID related, and we have 6 that are in the ICU currently, which is a little bit more than half of the ICU capacity. The challenge is that can change on a dime. When people come into the hospital with COVID, it's typically a very long dwell time, meaning you're in the hospital for 2 weeks or more. And what that means is the normal volume and throughput starts to shift. And so what that means is if you have somebody who's in the ICU for 2 weeks, that bed is occupied. And so that's where the challenge comes in taking care of those sick COVID patients is relative to that ICU capacity.
All right.
Roger, just to clarify my response, those 22 patients I referred to that have COVID represent about 30% of our total inpatient population as of this morning.
30%. Thank you. We have any other questions from the press? Feel free to step forward right now if you do. All right. We end today's press conference with a closing statement, if they desire, from each of our 5 participants up there. And if you would, we'd start with Denise Burley.
Certainly. I want to thank the 4 CEOs for making time for this press conference. I know they have very busy schedules, but it's of value, I think, to the public to hear them speak and not just public health. And I want to thank you all for that time and energy and being here in person to participate. Thank you.
Just want to end with our mantra that we've been using for quite some time. Wash, mask, vaccinate, and distance, and stay safe.
So I want to take a little bit of a different take on a closing comment. This has gone on for a long time, and there's not an end in sight. And people everywhere, healthcare workers, et cetera, are frazzled. I do want to just give a huge shout out to every staff member at KRMC as well as any healthcare worker for continuing to lean in and continuing to show up. And the request that I would have is, as this continues to go on and as people continue to be frazzled, just remember that being kind is a great way to get your point across.
That's a good comment there, Will. I would also like to thank the staff at Havasu Regional Medical Center. Again, they have stepped up for many, many months and are doing a fantastic job, and we really appreciate all the work that they are doing. And then just, a couple of things. One is that the data right now does show that vaccines work, and so I would just ask people to consider getting vaccinated, because I know there are a lot of anti-vax people out there, but look at the data. And look in the hospitals. We're speaking from firsthand experience here. So that's one thing. And then the other is that there are other testing. Will talked about it, or therapies, I should say. Will talked about it at the beginning with the monoclonal antibodies. That's available in Kingman. It's also available in Havasu through our urgent care. So people who are having symptoms within the first 10 days of those symptoms, there is a treatment that can help them get over them faster and potentially keep them out of the hospital. So keep that in mind as well. But other than that, thank you for allowing us to be here.
Thank you.
I really want to say thank you to our employees, our physicians, and our providers inside of our hospital. Again, this has gone on for an extended period of time. This is somewhat unprecedented in modern time. For the community and our volunteers who have been supportive of our hospital, we greatly appreciate them. This has been very impactful to everyone. This is impactful and has touched many lives in our communities. And as a hospital, our role is to approach this from a balanced perspective. We want to be respectful of individuals' choices and their beliefs. But again, those of us who are experiencing this firsthand and seeing the patients inside of our hospitals, the impact it's having on our staff and our physicians, we ask that the communities be supportive of all the work that's happening inside of our 4 facilities and the work that's being generated to be able to continue to care for patients. And also, I want to touch on the fact that our hospitals continue to remain safe places for patients to come for their care. Please do not put off the care that you need to have today. We would like for you to come in for all the other things that you need. We're not just here to take care of those patients that have COVID. Obviously, that's a top priority for us now, but also our top priority is that balanced approach in caring for our entire community. So again, thank you to our staff. Thank you to all the support we've given each other as hospitals. And again, thank you for the support that we're getting from the County Health Department and all the efforts we're putting forward here.
I want to thank all of our area hospital CEOs and County Health Director Denise Burley for participating in the press conference today. And I also do want to thank, regardless of their feelings, the people in the audience. They have opposing views on some of what has been said, but they were very respectful. I appreciate you for listening to what they had to say. Thank you very much. I would like to say a favorite line from one of my all-time best TV shows of all time, Hill Street Blues. Let's all be careful out there. Thank you and stay safe.
Thank you.
Good morning, everyone. Let's call the May 12th, 2021 Planning and Zoning Commission meeting to order. Would you please join me in the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please.
Chairperson Jacks?
Here.
Commissioner Barlow?
Here.
Commissioner Kelly? Here. Commissioner Hassett?
Here.
Commissioner Meal?
Here.
Commissioner Martin?
Here.
Commissioner Abbott?
Here.
Commissioner Alexander?
Here.
Commissioner Morse?
Here.
Vice Chair Gillette?
Here.
We have a quorum.
Thank you. Automated announcement, please.
Anyone who has not signed in, please do so at the table located in the lobby. Should anyone wish to speak, please complete a request to speak form, which is also located on the lobby